This is a brief introduction to your Medicare choices. And when it comes to Medicare, you do have a number of choices to make about your coverage. But first, let's take a look at how Medicare works. Part A of Medicare is hospital insurance. It has a deductible. It has no premium. It covers hospitalization, skilled nursing, home health services, and hospice. Part A has some additional costs that come into play if a person is in the hospital for a long time. Part B is medical insurance, and it has a monthly premium. And some people do pay a much higher premium if their income is over $85,000 per year. Part B has a relatively small deductible. Part B pays 80% of doctor bills, ambulance charges, and some very big bills for cancer treatment, and also most non-hospital medical services. There is no cap to your 20% coinsurance, and this is what can result in very large and never-ending medical bills. Coinsurance and deductibles are gaps in Medicare, and most people want to fill these gaps and protect themselves from large or never-ending medical bills. To do this, some people will get a Medicare supplement. These plans are also called Medigap plans. Medicare supplements don't have fancy names, but rather they have letters. Plans C and G are popular because they fill most but not all of the gaps in Medicare. Plans K, L, M, and N have lower premiums because they don't fill all the gaps, and they leave a person with more copays or cost. When I talk about Plan F, I say think F as in full coverage, because Plan F fills all the gaps in Medicare. Because Plan F fills all the gaps, it will have the highest premium. When you buy a Medicare supplement, you should purchase a standalone Part D plan for your drug coverage. Part D is voluntary, but there is a late enrollment penalty if you don't sign up when you are first eligible. Wait 5 years to enroll in a Part D plan, and you will pay a 50% premium penalty. So what is the cost of this coverage? There is the Medicare Part B premium, and $147 per month is the cost in 2014 for a person who is turning 65 in Arizona who buys a Plan F. Now, premiums vary from company to company, but this is the cost with the two largest Medigap carriers in Arizona. Prices can be much higher or a bit lower in other states. In Connecticut, a Plan F costs about $100 more than a Plan F in Arizona, and this is with the same company. Part D premiums range from $12 to $90 per month, and the plan you choose would depend on the drugs that you take. In Arizona, there are 29 Part D plans to choose from. Why so many, I don't know. $32 is the average cost around the country. So, one way to arrange your Medicare coverage is to use Original Medicare, and then fill the gaps with a Medicare supplement, and then get a standalone Part D plan. But there is another way to arrange your Medicare coverage, and that is with a Medicare Advantage plan, also known as Medicare Part C. Most Medicare Advantage plans in Arizona have no monthly premium, and they include Part D drug coverage. Most Advantage plans also throw in a free gym membership, and some, but not many, provide basic dental benefits like once per year x-rays and twice a year cleaning. So let's take a look at how Medicare Advantage plans work. If you choose a Medicare Advantage plan, you have replaced your Medicare with a private insurance plan, and you use that plan's ID card when you receive medical services. Most Advantage plans require you to use their network of doctors and hospitals. And referrals are required from your primary care doctor if you're going to see a specialist. We have some PPO plans in Arizona, and these allow you to go out of network. at a slightly higher cost, but these PPO plans will definitely have a premium, and a substantial premium. Referrals are not required in PPO plans. All Advantage plans have copays for services, like a copay for the doctor visit, labs, hospitals, and things like physical therapy. Chemo and radiation will require you to pay 20% coinsurance, up to a certain limit. If you're thinking about enrolling in a Medicare Advantage plan, there are some important questions you need to ask. Are your doctors in the plan's network? Are all of your doctors in the network? Are your prescriptions covered, and at what cost? And what is the max out-of-pocket for the plan? Some plans have a MOOP of $3,400, while most have a $6,700 MOOP. This protects you from never-ending medical bills. So why should you work with me to sort through your Medicare choices? Well, as I said earlier, there are way too many Part D plans. And there are about 30 Medicare supplement companies operating in Arizona, some of which start you out with a low premium and then jack up the price a year or two later, and if you have health problems, you could be stuck with that plan. There are many Medicare Advantage plans to choose from in Arizona, each with a different network, copays, and restrictions. There are also chronic illness plans that can save you lots of money if you have heart problems, breathing problems, or diabetes. And there are plans for people with very low income who qualify for Medicaid. I usually can tell if someone qualifies for extra help with their Medicare costs and their drug costs, and I can help them apply for this assistance. My name is Denise, and I am an independent insurance broker. That means I don't work for one company, and I don't push one type of coverage over another. I educate my clients about Medicare supplements and Medicare Advantage, and I let them make their own decisions about their coverage. I am contracted with most of the plans in Arizona, and I do get a commission if you enroll through me. You can call me or email me to ask me questions or to set up an appointment. I thank you for listening to this presentation, and I look forward to working with you.